Hello, are you one of the many people diagnosed with a debilitating condition known as CIDP, also called chronic inflammatory demyelinating polyneuropathy? Have you lost your ability to walk normal? Have you lost your ability to feel your legs and your feet? Have you lost your ability to use your arms and your hands? Have you lost your ability to take care of yourself? Have your doctors told you that your immune system is attacking you and they don't know why? But you want to know, why would your body do this to itself? Why? Why would your body just attack itself? Doesn't it love itself? If you want to know why, keep watching this video. In this video, there's 3 parts. One part, you're going to watch the before and after video of a woman who's overcome tremendous odds. She is actually without medication when the IVIG did not work for her and other medications did not work. Maybe it's working for you, but you want better. Maybe it's working for you, but for her it didn't work. You're going to see the before and after of her walking with no more cane, with no more bilateral foot drop, and she has feeling. She can take care of herself now. The difference is incredible, night and day. The second part of this video, you can hear the testimonial of this woman, the patient, and her husband speaking about their history with the CIDP and how she's gotten better and overcome all odds with this unique care that I offer. And the third part of this video, you're going to hear me talking about the unique exam findings, which hidden infections, hidden disease-causing infections and toxins were in her tissues that made her body break down to such a debilitating degree with what was diagnosed as CIDP. If you want to know why your body's breaking down, you've got to look outside the box to get some answers. Watch the rest of this video. See you on the other side.
Okay, let's see you get up from the chair. Easy. So without his help, it's not possible to get up. Okay, it might be possible, just harder. Good. Okay. Come on back this way, and you'll go walking on the hallway. Let's see if without yeah. So with no cane, still with the difficulty right now. She'll fall trying to get up. You were saying?
She probably would.
Yes, they do that. Yeah, you know that you may.
All right, come on back this way. You're turning easily. Look at that turnaround. 360, no problem. Look at this coming back. Look at this walk. So she's always falling over to her right. Keep walking past me, please. So
That's her weakest.
The right. This is just incredible. Incredible. Look at how fast she's walking. So let me, if you could stand right there, don't move anymore. If you could put that pole in, don't hurt yourself, but if you could take that pole and put it in your left hand. You use it on the right because you're going to fall right. Is that why you do that with the right hand?
Yeah, and she doesn't have so much strength in
I just want to see what happens. If you're standing there with it, even what if you don't hold the pole and just try to stand up without the pole? Just if you just try to stand there, and are you going to fall?
Probably.
Let's, yeah. Okay. So you're falling forward. Does it only fall forward?
Sometimes backwards.
Sometimes backward. What about right or left?
No.
Never right or left. But you keep that in your right arm. Why do you keep that tool in the right arm? More strength. Just more strength in the right arm. Hello, I'm Dr. Lonnie Herman with another great example of how the unique care that I offer people can help people to change, to save their life, to change the function of their nervous system, to get stronger and function better and feel better. I'm with a husband and wife, patient, this woman here, I don't want to mention names, let her keep some of her privacy, but you came to me, you're from Tennessee. You came to my clinic here, I'm here presently in South Florida, and you came in for a condition that originally, back in, when did you notice you had this condition that they diagnosed originally as chronic inflammatory demyelinating polyneuropathy, also known as CIDP? When was the original symptom that you felt? Or is that, it was in 2017?
In 2017,
about
in August.
July, August of 2017 was the first symptom, right? That's when you first noticed you were having changes in your function. What were the first changes in what they originally diagnosed as CIDP, or chronic inflammatory demyelinating polyneuropathy? What was the first thing that occurred? Was it weakness in the legs? Was it numbness in the feet? Was it pain? What happened?
Tingling, and then she was like not able to walk, and she couldn't use her hands for, it was like almost like instant problem, less in than 6 hours, she was just unable to do anything.
Just like it happened instantly.
Yeah,
It was just
yeah.
like boom. Then she couldn't
Yes.
do anything. She couldn't walk.
Yeah.
She couldn't move her legs. She couldn't move her feet.
No.
You couldn't even move your toes or your feet before,
No,
right?
They
No,
dropped.
no.
Right.
They
They
dropped.
And the
dropped
hands,
it.
you had no control with your hands. And
The
you had
numbness of three
numbness,
fingers.
and you had the tingling in the feet, tingling in the hands and feet as well.
Yes.
And then the feet all of a sudden became numb.
Yeah.
And you went through different tests, and you went to different doctors, neurologists, and they ran nerve conduction tests on you. Did they do MRI of the brain and spinal cord? What other
Yes.
tests? Blood
Yes.
tests?
Blood test, nerve conduction test. They done actually in Istanbul. First time they done.
In Turkey, they did an X-ray.
Yeah,
You actually got
MRI,
sick over there, yeah.
And then after that, we done in Europe, some other hospitals as well, and they could not.
They couldn't
really
find
tell.
out what it
They
was.
could
And here
not-
in the U.S., you had nerve conduction, blood
Yes,
tests, MRI.
yes.
You did
Till
more.
we- yeah.
And originally, they called it chronic inflammatory demyelinating
Yes.
polyneuropathy, or CIDP.
Yes, CIDP.
And
yes.
then they gave you right away with their medications that they put you on before you started with me in November of 2017, our first visit.
Right.
Did they put you on medication already at that time? Because we spoke around October, November, or September of 2017, our original consultation before our first exam here in my clinic. Did they have you on medications already at that time by November of 2017?
She
What?
was on the IVIG,
IVIG.
and gabapentin.
And gabapentin, okay.
Yes.
And were you noticing between, and that was by what, like October of 2017 on the IVIG?
She started in September, and she was doing already 3 rounds when we came here. And after we came here, she done 1 more,
Okay.
and then we stopped because
you
it was
stopped.
not improving.
It was not
Or
improving. So the
it was not
IVIG
hurting her. It was not
hurting.
helping her.
Not helping, not hurting. So
Yes.
in essence, it was hurting because it couldn't help her. Because she
Right.
was still dealing with
Right.
this crippling disorder that you'll see the video of. I'm going to share it. And you were still dealing with the numbness, and you're still dealing with a lot of fear, anxiety, stress, worried. The whole family worried about you,
Yes.
yeah? Worried about what's going to happen to you because it wasn't getting you nowhere. So the IVIG got her
No.
0 results.
No.
And so we started in November, and then I saw you again in April of 2018. This is June 27th of 2018. And you did have a medication that you started with that you said you felt a little bit change in, but
Yes.
in that time you also had completed your first protocol with me. And you had gone back to, because you went to some university, I don't want to mention the name of the hospital or
Yes.
the doctors that you went to, but you went to a university. They ran, one of the very interesting findings was that this rheumatologist ran a blood test on you, a follow-up blood test, where they originally found, in the original blood test, they found that you had the ANA positive antibodies. You presented that to me when we first met in
For
November.
many years, yeah.
And then you went to these rheumatologists in this university hospital in Georgia, and they ran all these seven or so many nerve
Yeah.
conduction tests all day for hours, right?
Right.
And then they also, she reran the blood test on you, checking the ANA antibodies.
My rheumatology doctor.
The rheumatology doctor ran the ANA antibodies again. And one thing that she said when she ran the test was,
She was so confused. It
well,
was
no,
negative.
originally what did she say? These can never change. They're always
Yeah,
going to be positive.
Yeah. They say
So-
this. They say when you actually one time ANA positive, it would never.
It's positive, can never
it's
be
positive,
negative.
It stay positive.
And so when she ran that test and invited you back in to go over that blood test, which is right after you completed your first
Right.
protocol from me,
Right.
what did she say? What was her face like, and what did she say to you about that new ANA test?
She was looking like very confused, and she didn't know what to say. She said, "I don't know. Your test is negative, but it could be misread or mistaken, but we're not sure. But honestly, I don't know how this happened. But you just be happy that you don't have."
Yeah, so what really happened was that she followed a protocol to get rid of the hidden disease-causing infections that I found in her first protocol with these unique remedies to get rid of those infections from your tissues in the first round. That doctor reran that ANA antibody test and found it negative, and she was dumbfounded. How could that be? Because she originally told you, and she's depending on that lab, so it can't be
Yes.
wrong reading. She depended on that to give you answers, and she
She didn't know what to say.
she didn't know what to say. Now, right now, after your second protocol, we came in for a third exam today. Your original presentation, which again, I'm showing the video here before and now 7 months after she started her unique care with me. Your feet were completely numb before, right?
Yes.
No feeling. Your legs were numb. And now you were able to feel somebody touching your shin, your ankle, And your feet, you told me that when you can step barefoot on the floor, now the feet have pain because there's sensory coming back to them.
Yeah.
But when you step on the floor barefoot, you can tell if the floor is cold. You can tell if something's on the floor that you stepped on.
Yeah.
You feel things now.
Yes.
Or do your hands function normal?
Almost.
Almost normal. They feel pretty good.
Yeah.
Can you write
Yeah.
with them? You
Oh,
can
yeah.
drive.
Oh,
You
yeah.
drive yourself around
Yeah.
now.
Yeah.
Could you
everyone.
drive yourself around when you first met me in November?
No.
No, that was impossible. People had to chauffeur you around. You were the guest in the car, right?
She
Yeah.
couldn't even get to the car
couldn't get to
without
the car.
assistance. No.
She couldn't even, I'm sorry, hopefully this doesn't embarrass you, but the crippling condition was so bad, and we're doing this to help other people realize that they can save their life. This is all about the person out there who needs to know. So your crippling condition was so bad, you had a very difficult time even getting to the bathroom yourself, correct?
Of course.
You couldn't take care of yourself in any way. People had to wait on you.
She
yes?
was on the walker for a long, long time.
The walker for a long time. It was bad, very bad, and you were worried. And now, do you feel better?
Yeah.
You're not 100%. We know you're not 100%. Do you feel better?
Yeah.
You
Much
driving
better.
yourself around?
Yes.
Can you
good.
get dressed by yourself?
Oh, yeah.
Can you go to the bathroom by yourself?
Yes.
Can you take a shower by yourself? Do you feel like you're losing your balance anymore like you did when I first met you?
No.
No. Can you walk and turn around in a circle like you couldn't do before? Now you can,
Yeah.
right? We're getting you there. So we've been removing, and I'll make another video for this. I'm going to let them go. I'm really grateful that you have shared this, at least to be able to let people know that I'll say that this is working for you. You believe this is working, and you can say it's been working. You
Yes,
Yeah.
it's working.
100%.
And I was so happy when I actually looked through some videos and do some research on CIDP, and I run across that video with Dr. Herman, and something was just telling me you have to go to this guy and you have to make your way there. And I trying to convince my wife to go, and she was like very skeptic, like I'm pretty sure a lot of people would be. I mean, if you don't know where you're going, what's going to come up. And I was like, well, let's try. There's nothing we can lose. You can just get better, or it's not going to get better. So thank God we came here, and we worked, and we were in good place. And
Thank you. Because you
I
weren't.
would-
Because
yes.
you're welcome. Thank you. At least a smile today. So the methotrexate they gave you didn't work. You stopped that months ago.
Yeah.
Yeah. So the IVIG didn't work. You stopped. So she's been off of the meds for months, and still progressing with my protocols that she's been taking. And now it's a big world of a difference. It's almost like night and day completely from where you were when you first met me.
it is.
And those medications weren't really getting you to this point. So it's been months without the meds. But from what you found from me online, it all made sense, Sir?
Yes,
It
yes.
made sense. And but with all of the seemingly very knowledgeable physicians and doctors that you went to in the university, and with other private physicians you went to, and in Turkey and in Europe, everybody left you kind of with like, we don't know what.
They
don't know
know.
what's going
They basically, they even told me in one hospital, they said this hospital exists more than 70 years, and this is the patient that we never saw in our history like this, that we sending somebody home without a diagnosis.
And they had no idea.
They told me basically we don't know.
So the purpose is to get you well. I will make another video that I can edit in my findings from the exams. There's nothing too private for those. We're just talking about different viruses that are commonly contracted by people through a bug bite, or talking about Lyme disease and so on, right? That's pretty much basically what we're finding, but it's a very unique method of analysis, a very unique method of pinpointing and safely removing these hidden disease-causing infections and toxins to help regenerate the nervous system. I'm really happy to say that we're seeing your life come back to your body, and it's great, and you're smiling, and we're not worried as much as we were when we first met. We're still going to get there. We still have more improvement, but you're a night and day. So I appreciate you both getting on this video with me to share with the public. And you think other people who are suffering with a chronic inflammatory neurodegenerative, seemingly inescapable, seemingly that medicine can't help them, or maybe medicine, they say that that's all they have to offer. Do you think that those people who are watching this video should give this a chance with a doctor like me, with me?
Yes, I definitely would suggest everybody, whoever have a chance, to come here and talk to Dr. Herman, because we found a very, very good cure here, and we were so blessed that we even came here.
Yes.
All I can say.
Thank you. Yes.
My name is Dr. Lonnie Herman, and in this video, I'm sharing with you the unique exam findings which I discovered through a unique examination process, which I do perform in my clinic, which is located here in South Florida. And this unique exam process allows me, through a very unique bioresonance testing system, no machine involved, no computers involved, with this bioresonance system that I can actually listen to the tissue in the body, whether it's the nerve, the myelin, the glial cells, which reproduce the myelin and repair your central nervous system tissue and peripheral nerve tissue. To listen to your bone marrow, your cartilage, to listen to parts of the brain and the cerebrospinal fluid and the meninges, the pia layer of the meninges, the dura layer of the meninges, your lymph. We can listen to these tissues and find which infection specifically and or toxin, or let's say multiple infections and or toxins, are causing your condition. So, in November, when I did a unique exam with her, and again, tapping into the tissue to find and remove the hidden disease-causing infections and toxins from her specific tissues, I found throughout her bones, her cartilage, her lymph vessels, and her blood vessels. And there's a unique way to do this. I won't get into great detail of how I do what I do in this video. We can talk about that in pretty good detail. It could take me about 30 to 40 minutes to describe what I'm doing, but we can do that on an individual basis. I found that she had Lyme infection in her bones. She had Lyme infection in her cartilage and within her lymph. I also found that the glial cells, her glial cells, which are cells, again, let me repeat, you have cells, we all have cells in our central nervous system, which are known as glial cells. And there's different kinds of glial cells. I don't have to get into great detail about that. These glial cells are the cells which, one, they repair central nervous system tissues. Two, they repair, or I should say reproduce, the myelin coating on your nerve tissue. So what would happen, before I tell you what I found in there, what would happen in your body if the cells which are supposed to reproduce the myelin, if they're infected and they have chemicals in them which can degrade their ability, disable them so that they can't reproduce the myelin? So your doctors may tell you that CIDP is a condition where your immune system is attacking your myelin and they don't know why, and it's your body going crazy, your immune system is just attacking you, and that's it. It's an autoimmune disease. Before I go any further about her exam findings, I took postgraduate study for hundreds of hours in functional neurology, in human brain dissection. I also took postgraduate study in neurochemistry and neuroimmunology, and there's some others. I won't go into all of those other details about my postgraduate studies in the past 11 years. In the immunology program, the neuroimmunology program in particular, I should say specific with the right title, we had one of the world's most recognized immunologists, a PhD in immunology for about 40 years of time. And this doctor had shown us research paper after research paper. I'm talking dozens and dozens and dozens of papers from laboratories around the world where these scientists are studying for the cause of disease, not to say that the medication was the right answer, which is funded by the pharmaceutical industry. They were finding in biopsy tissues of various parts of the brain and the body that there were infections in these tissues, parasites and viruses and bacteria that were causing, and fungus and mold, and even chemicals that can cause degradation of the tissues. I went on a journey to find a way to be able to tap into those tissues and see what's causing them, because there is no laboratory on the planet. You can run a blood test looking for Epstein-Barr virus, or looking for herpes, or looking for mycoplasma, or looking for Lyme. You don't know where these infections are in the tissue. It's not just it's in the blood. You've got to know exactly where to be able to design a program to be able to go after them and help eliminate them. You got to know where they are. You got to be able to find things that may even evade blood chemistry analysis, or spinal tapping analysis, or MRI analysis, or nerve conduction test analysis. So in her glial cells, they were also infected by the Lyme infection. Lyme disease. Maybe you've heard of that before. In her glial cells, stressing her glial cells. Those cells which repair the nerve tissue and reproduce the myelin, they couldn't get the job done because they were infected. Now, whether the immune system, let's step back a moment before I go through other findings in this first exam from November of 17. Maybe the immune system is attacking the myelin. Think about that scenario. If the immune system is attacking the myelin, why? Didn't just go crazy. Your immune system didn't get drunk the night before and wake up and say, let me just go cause problems in my body. That's not reality. The reality is your immune system is doing what it was programmed to do, which is protect you. Protect you. to protect you by eliminating infections from your tissues. Now let's pose this question. If you were up against one person who was threatening your family, that one person was the same size, speed, skill, strength as you are, and you had to defend your family, you probably have a 50-50 chance of winning in that battle. What if you were up against 50 people at the exact same time attacking you all at once? 50 people the same size, speed, skill, and strength as you are. Are you going to win? Probably not. Without a gun, without a bat, without some other weapon, if you just had to defend with your hands and your feet and your mouth and you're trying everything in your power to be able to win, you're probably not going to beat 50 people coming at you all at once. So when you have various infections, multiple infections and toxins in your tissues and your body, your immune system is not strong enough. It's not capable to beat all of these different infections and chemicals coming at it constantly. Furthermore, the immune system may attack the myelin, but what's on the myelin that it's attacking the myelin for? Maybe there's a virus, maybe there's 10 viruses, maybe there's Lyme, maybe there's mold, maybe there's fungus and parasites and bacteria, maybe all of the above. Maybe there's some mercury that got onto your myelin. Yet, what if there's an average normal wear and tear? Maybe, scenario one, your myelin is infected, your immune system's attacking the infection on the myelin, and it's ending up to destroy the myelin. Maybe that's the case, so we have to find what's on the myelin and find infection, which we can do with this method. Number one. Number two, maybe your myelin is not being attacked by the immune system. What if your myelin is just on an average wear and tear throughout life, and your cells, called glial cells, which are supposed to help you repair and reproduce the myelin, what happens when those cells that are supposed to do the reproduction of the myelin and repair the central nervous system tissues, what's going to happen when, and even peripheral nerves, they're called something else in the peripheral nervous system. I won't go into more detail there. I'm not here to make you a neurologist, but help you understand something that what happens when those glial cells are sick, when they're infected and they have chemicals in them and they can't do their job of reproducing the myelin. Maybe the myelin's normal wear and tear, maybe, that's a hypothesis I have, and the glial cells are not able to do the reproduction. Further, third scenario, the glial cells can be infected and not get the job done, and the myelin can be infected and have chemicals that are destroying the myelin too. So 1, 2, or 3, you pick, but here we have real proof, real person, and they're stating it, and you hear them discussing it with me. They are getting better, she is getting better from this work with me, and the IVIG did nothing for her. I'm not saying it can't do anything for someone else. Maybe it does, but not for her. So her glial cells were infected with the Lyme. I found her small intestine infected with the Lyme in this first round. I also found that her stomach and her large intestine infected with the Lyme. No, I don't take a biopsy of the tissue. And there's a specific way of tapping into these tissues and finding it. Real science developed by biophysicists in Germany. In her second exam, which was in April, she seemed to be a little bit better, but no dramatic, no incredible improvement by that point. They came back. It was their only hope. They tried other things, not getting any results. I found in her glial cells, I re-inspected them. These cells repair the central nervous system. They help with the peripheral nervous system, but they also they reproduce the myelin. What happens when they're sick? What happens when you're sick and you can't go to work to produce for your family, for yourself, to pay the bills, to put food on the table, to pay for your car, to pay for your house, your electric? What happens when you're sick and you can't get out of bed? Okay, you can't produce. What happens when the glial cells are sick and they can't produce? Does it make sense? Her glial cells were infected with a bacteria known as rickettsia. Her embryonic stem cells, called mesenchymal or mesenchyme cells, Lyme infection. Now something else that was unique, her stem cells which make her blood in this round. Stem cells which make the blood, called hematopoietic stem cells. Hematopoietic. Cells that produce red blood cells, white blood cells, and platelets. These are located in your bone marrow. Those hematopoietic stem cells, the rickettsia. Her meninges, which the dura layer in particular, rickettsia, your meninges are a thin layer, there's 3 different layers to be exact here, but thin layer of coating, sort of like a skin around the brain and spinal cord, and the cerebellum. And they have nerve endings and blood vessels that are deeply invested. These tissues are connected to your central nervous system tissue. What happens when they're infected? Can we have a paralyzing condition? Sure. I found in her brain stem, which helps sensory and motor control of the body. I found, without getting too detailed to help you understand more, but you have a tissue inside your brainstem known as the reticular formation. I'll show you a picture here of it, give you a bit more of an understanding where it is located in the brain. There's a drawing I'll put up. The reticular formation is, we depend on this reticular formation to help us speak, swallow, breathe, heart rate, heart function, digestive function, also to make our limbs move. It is also helping us understand sensations. Stepping on the floor, stepping on a tack, I can feel that. Hot, cold, something sharp, something soft touching my foot. I feel my socks on my feet. She couldn't feel that in the beginning. Rickettsia bacteria affecting her reticular formation. I also found in a part of the brain, and again, unique exam, we can tap into these, whether you want to believe it or not, you're seeing proof, you're hearing the patient here. If you still want to go the route of medicine, you have every right to do so, unless you want to step outside the box and look into other methods. This part of the brain known as the prefrontal, she had Lyme. She had chemicals from previous surgeries, one of which was xylocaine, which is a local anesthetic that can be used in a C-section. It's a lidocaine-based local anesthetic that's used in C-sections. It can be an epidural injection. It's also, thinking of lidocaine base, it's also then that base of the lidocaine that's in this chemical can be from dental work where the chemical stays in the body. Yes, these chemicals from procedures can stay in the body. Don't believe that you just sweat them out or poop them out or pee them out, or your kidneys and your liver just filter everything and everything is back to normal. You are what you eat. You are what you eat. You are whatever comes into your body. Understand, let me give you an analogy. If you took a white t-shirt, take a white t-shirt, put it into water with a blue dye. Leave it there 10 seconds. Take it out. What color is it? What color? Blue. Let it dry. Wear it. Sweat in it. It's still blue. Put it in the washing machine. No bleach. No trick here. Put it in the washing machine. Put some detergent. No detergent with detergent. No bleach. No whitening formula. When it comes out of the washer, it's still blue. Maybe it faded slightly, but it's still blue. Put it in the dryer. It comes out. It's still blue. Do that 100 times. It's still blue. It may have faded, but it's no longer white. Any chemical that gets into your body can stay there. It can stay there and cause your body to not function well. Get that. When you have an injection into your mouth to do a cavity filling or a root canal or a tooth extraction or take mercury out, when it's numb and it wears off, where did that chemical go in the hour or two after the injection and the injection wears off and you could feel and swallow and speak again after the dental procedure? Where'd it go? After a C-section? After an epidural? When your legs are numb or your back is numb? Where did the chemical go when it wears off after a woman having a C-section and the legs are numb and sort of paralyzed and they don't have much motor control, when they don't feel the lower half of the body, to get cut open and have a birth? Where did the chemical go when the sensory comes back in the limbs? I found that in her premotor cortex of her brain. I also found that chemical with the reticular formation. Back there again, sensory and motor. What's going to happen when it's numbed a bit? I found scabies in this prefrontal, premotor. I found propofol, a general anesthetic from a previous procedure that she had, still there, affecting the motor or part of the motor controlling part of the brain. She came back to me in June, and there you saw the video. This exam, I rechecked her June of 2018. Next exam, she's doing a lot better. She has feeling in her legs and feet. She can dress herself and drive. She doesn't need the walker. She's not taking any medications. I think at that point for 5 months there was no pharmaceuticals used. Just this protocol. Her cerebellum of her brain, we had to get to this time. Dengue fever, and I found this all throughout her. Dengue fever is a virus that we can get from a mosquito bite. It can happen anywhere in the world, not just in some South American country or somewhere else that only happens to those people somewhere else. You can get dengue fever from a mosquito in different parts of the world, whether it's the U.S., whether it's Canada, whether it's maybe you've been on a trip somewhere, you live somewhere where there's so these reports online will say that there's no dengue in this part of the world. Maybe you traveled somewhere else and you were infected by a mosquito. Maybe. In her cerebrospinal fluid. The cerebrospinal fluid is fluid which surrounds your entire brain and spinal cord, your entire central nervous system. It surrounds and protects your brain and your spinal cord and your cerebellum, and that fluid actually is absorbed all throughout your entire brain, your brainstem, your cerebellum, your spinal cord. All of your central nervous system tissue is surrounded, protected, and absorbed and wet, moist with the cerebral spinal fluid. What do you think is going to happen to your central nervous system when the fluid is infected? And they're not finding it, they're not looking for it. What do you think is going to happen to the central nervous system? Nothing good. Can't be good. What do you think is going to happen? What do you think your immune system is going to be doing when it knows that these infections are in your tissues, especially the fluid, especially in the central nervous system? What is your immune system going to do to the tissues that have this virus in it? Do you think it's going to attack? Do you want it to attack the virus? Sure you do. Yet it's so overwhelmed. But here we see her improving incredible improvement, incredible. When she came back in September of 2018, after 3 protocols, doing better, stronger, some pain in the feet, but it was more like there was a tingling. The life is coming back. You know, if you ever sit on a toilet too long or cross your leg too long, your leg can fall asleep, your foot falls asleep. When you stand up after the foot fell asleep, how does it start to feel when it starts coming back to life? When it starts to feel again? You start getting tingling. It feels like these pins and needles all over the place. Well, when there's blood supply that's going back is what's happening. You cutting off the nerve, cutting off the actual blood vessel supplying the nerve, the foot falls asleep. When you untrap that blood vessel that was kinked, the blood flow goes back to the nerve and more oxygen to the nerve, we get tingling, sensory coming back. In this round in September, I studied her cerebral spinal fluid again. We cannot have normal central nervous system function when the cerebral spinal fluid is not clean of different infections. Mycoplasma bacteria affecting her cerebral spinal fluid, affecting the central nervous system. Epstein-Barr virus. I found her meninges were still infected. This time, I found another bacteria. This bacteria is called Clostridium difficile. It doesn't have to only show up in the poop analysis. It can be in other parts of the body. Organisms can travel all throughout the body. It doesn't have to just be in the gut and think a leaky gut causes everything. Or take probiotics. When you've got an infection that travels through blood vessels to different tissues, it can harm anywhere. Her thyroid was infected, and parathyroid gland were infected with the influenza. I found her liver infected with the influenza. I also found in this round that her kidneys and her glial cells and her cerebral spinal fluid were toxic, heavily toxic, or let's say heavy intoxication or heavy toxicity from the dental mercury. Now, she still had mercury filling in her mouth. We didn't even go after that yet. Look at the amazing improvement again. The amazing, significant recovery that she's experienced with this work without getting the mercury out of her teeth at that point. She was too weak to get it out. And she questioned, I don't know about the mercury. Okay, we started off, I let it stay. Now in September, she comes in, and I found that there was the dental mercury that was stressing her glial cells, her cerebral spinal fluid, and her kidneys. We weren't treating the dental mercury to get that amalgam. And you could watch, listen, I'm going to put in some other videos before I tell you what I didn't treat and what I am treating. And this video will be just a few minutes longer every time. When you look at these other videos up here, that I'll put up here, let me actually show you like a screen, a shot. I'm actually going to show video of me scrolling through different YouTube videos that you should pay attention to. You should watch if you don't realize, and your dentist may say the mercury is fine in your mouth. Well, it's a biohazardous toxin. When they take it out of your mouth, guess what? They can't touch it. It's toxic. Guess what? They can't just throw it in the garbage or wash it down the drain. It is a biohazardous material. They have to put it into a biohazardous container, and they have to have it removed by a specific company from the clinic. So how is it okay in your mouth? Believe what you want. We're getting the job done here. Watch those other videos I'm showing you online. Root canals are another problem. I'm going to show you a couple of other pictures of people with dental work that I discovered. I do another kind of exam that's a unique dental exam that I perform, where I can actually find different infections and metals underneath crowns. I'm going to show you a couple of images here. One, you'll see a crown that came off. This woman was about 49 when I examined her. She had a horrible autoimmune thyroid disease. I told her this tooth in the bottom was bad in her mouth. It was causing a big part of the complications with her Hashimoto's autoimmune thyroid condition. And she didn't believe me. She said her dentist said the tooth is fine. I told her, you can't see through the crown on x-ray. How do you know? How does your dentist know? It's a 20-year-old crown. You could have infection. I think you do from the exam I found. She went to a dentist, pulled off the crown. You're going to see in this image the crown is upside down. So you're looking at a hollow, open metal shell and then the porcelain coating. So it's empty inside with porcelain on the bottom. So think of it as a metal crown comes off and it had porcelain, so it's a hollow. Now I'm going to show you the image of what was underneath that crown. Wow. Shocking. Infection, disease in the tooth that was going through the nerve and through the blood vessel, goes right down the carotid to the thyroid. Guess where else these infections can go from underneath crowns? Saliva, swallowing them, going to the brain. This is from a different patient, not this patient I just showed you when we were talking about with her CIDP. Here's another image. I'm going to show you a gold crown, 35 years old. I detected underneath this crown with my exam that she had mercury and infection. And you see pictures here. There was infection underneath that crown. You can see all these dark spots around the tooth. When they took off the rest of the dirtiness and cleaned off the tooth, a big chunk of mercury. Here's the image of it. A big chunk of mercury was in that tooth. The dentist said he got all the mercury out of her teeth. That's what they thought. High-priced dentist, biological dentist, missed it. Gold crown. Gold crowns are not safe. They're not good for us. We can wear gold on the body, not in our mouth. We swallow gold. We swallow mercury. Not good. Not good. And I'll also show you, here's something else that's very interesting. This is an 18-year-old. And watch another video of this young boy. He had a horrible skin rash. He had acute bronchitis. He had brain fog. He had learning disorder. And I found with him that he had an infection above a tooth. The CT scan proved it. I left the dental amalgam and the glial cells in the cerebral spinal fluid because she needs to get the mercury out of the teeth first, because you can't, listen, if you put a plug, let me use another analogy. You put a plug in the drain of your kitchen sink, turn the water on, leave the house for 2 weeks. What's going to happen when you come back in 2 weeks? It's going to be flooded. Yeah? Right? Well, you can't just take a Dixie cup and start trying to get the water out of the kitchen, throw it out the window when the water's still running and the drain is still plugged. You're not going to see an end of it. It's going to keep flooding in. She's got to get the mercury out of the teeth, which she's doing now. She's got to get the mercury out of the teeth before I see her again, which I think I see her again by March of 2019 now, to get the mercury out of the teeth. That way we can clean out these tissues of the central nervous system. There still is a toxic element causing her system to not be 100%. Dramatic improvement. It is night and day. She is doing better. Phenomenal. Incredible improvement. Okay? Listen, we've got to practice other methods. We've got to do different scientific work to be able to help you recover. That's what I do. I've gone through neurology postgraduate studies for hundreds of hours, neurochemistry, neuroimmunology, functional endocrinology, blood chemistry analysis. I got very deep into gastrointestinal disorders. I learned from an immunologist. I've learned about the leaky gut and tested with that and gave up on that test. I could talk more about that later. This is a pretty long video here. But there's different laboratories that we can run a blood test and stool test and saliva test. I used to do over $2,000 of lab workup before I'd even start with a patient. And there were too many times that these labs showed us no evidence of what was causing the problem. No evidence. So I had to move on and find other science that works. Okay? I've also had very extensive studies about dental work and their connection to disease of the body. I've had a biochemist who was a mentor for 3 years of my life. I've got cardiologists who are mentors of mine. I've got some incredible mentors to help me grow into this position to be somebody who can help with these chronic issues. You deserve to watch other videos on my YouTube channel. You can see a recovery of other patients from serious disorders in their body, whether it's Parkinson's or diabetes or migraine headaches or POTS syndrome, it's called, and there's others. Share this video with one friend, just one friend. Just share this video. It's easy. You can, just right below the video here, you can just click on, there's a little arrow that says share. Just send it to one person. Send it to one person, or maybe you're part of a group of friends who deserve to see the reality, the recovery, amazing recovery of this person, where they're suffering with their condition and they're not getting help and they want to get better. Maybe they have gotten a little help with their medicines, but they want to really get better. Okay? So they have a great chance with this. You can like me on Facebook. I put up information there on a pretty regular basis, and you can scroll through and look at the unique posts and videos that I put up and read about things that you may have never seen or heard before, of incredible recoveries taking place and a different viewpoint on what's going on. You can follow me on Instagram. You can follow me on Twitter. And definitely subscribe to this YouTube channel. If you just click the button here down on the corner of the screen, that's click subscribe, and then then you'll have to turn on notifications on your YouTube channel to get emails from YouTube every time I put up a new, interesting, and life-changing, life-saving video like I've just done for this video here. So you're going to get emails, and you'll be the first to know when I put up a new video. Okay? Unfortunately, insurance companies don't recognize my kind of work. Fortunately, we can do this work. Fortunately, you can see incredible changes. But unfortunately, the healthcare insurance doesn't cover this work. So it is an investment in yourself, for your body, and it may take us some time. Don't expect to get better in 1 day, 1 week, 1 month. Do hope it's going to happen, and I do too. I do expect you to have really incredible improvement with my work. I just hope it's going to be fast. I really do. Because the sooner that you're better, guess what? The sooner that we can show another incredible recovery with the world and help another person who's suffering. There is no cure. You've got to find... we're not treating CIDP. What we are looking for is what's causing your body to break down. Pinpoint and safely remove the hidden disease-causing infections and toxins that have caused you this disability. And let your body repair itself. Your body's going to fix itself when you get rid of why the breakdown has occurred. Okay? So call my clinic when you're ready to make an appointment for yourself or a loved one. The number here is 954-370-3100. Once again, 954-370-3100. You can send my clinic assistant an email right here. I'll put that email address up as well. Okay, we look forward to helping you. On an average, we're about a 3-month waiting list here to get into my clinic. People do come to me from around the world. We've had people from Thailand, Norway, Netherlands, Romania, Russia. I've had from China. I've had from Italy. We've had from United Kingdom. Many people from the UK come across. From Canada, from Mexico. I've had from Venezuela, other parts of South America, Peru, from Colombia, from we've had Africa, Israel coming here. So there's many people. If it's difficult for you, you're in a wheelchair. I don't know what else to say, but there are people who do come in a wheelchair into my clinic. Okay, so if it seems impossible, it seems real difficult, maybe you'll make a decision in the future, and when you just think, you know what, I've got to do something for myself. The only hope that I think I have possible. We got to give you some hope and give you some real steps to give you the strength to be able to help you repair yourself. And I believe it can happen. I'm here to help you. I look forward to helping you. See you soon.